Okay, welcome everyone. So now we are going to look at clinical features of tuberculosis and some of the most important topics about different high-yield questions. Clinical features of primary tuberculosis. Primary tuberculosis occurs when someone is the first infected with M. bacterium tuberculosis. It only affects children, young adults, especially those who live in the area of TB endemic. So that is known as primary TB. This condition is often asymptomatic. Patient do not have any symptoms, especially, and then patient does not show any symptoms. Infection may be discovered accidentally via chest X-ray. When we perform X-ray chest, patient shows infection in primary TB. Now, systemic constitutional symptoms like low-grade fever, night sweats, weight loss, fatigue, malaise, anorexia, and weight loss will be there in the patient. So, other symptoms, respiratory symptoms include dry cough, productive in nature, mild chest pain, shortness of breath, and there is extensive disease like tuberculosis. Lymphadenopathy is also there in the patient. Lymph node, hilar lymph node involvement, mediastinal lymph node, and seen in chest imaging and bronchial compressions is also there. Pleural effusion is also present. Patient has infection in the pleura. Pleuritic chest pain, cough, dyspnea is also there in the patient. History of primary TB. History presentation of primary TB is patient recent exposure to TB case like family members and children are immunocompromised. Patients are more prone to develop primary TB, and there are patient give the history may follow a recent viral viral illness and malnutrition. Patients BCG vaccination status may or may not be influence in the severity. Travel history is also there important in history of the patient. What investigations will be performed? For investigations we will be looking at chest x-ray, and there will be gone focus, parenchymal lesions will be there, tuberculosis skin test will be positive, and a sputum culture is there, and biopsy shows lymphadenopathy and granulomatosis necrosis is also there in the patient of primary TB. Antioxidants are also given in okay, so this is another point. Antioxidants, many questions are repeated about most potent antioxidant like glutathione. Antioxidants are substances that prevent or slow damage of the cells by free radicals. Unstable molecule produced by oxidative stress. Mechanism of action: free radicals damage DNA, protein, and cell membrane, so antioxidant neutralize those free radicals via reducing cell injury. Clinical features: patient having chronic cancer, atherosclerosis, neurodegenerative disease like Alzheimer's disease, and aging can have vital impact on the production of antioxidants. There are two types: endogenous and exogenous antioxidants. Endogenous like superoxide dismutase, and exogenous like vitamin C, E, and A antioxidants. Therapeutic uses of antioxidants like dystrophic calcification. Another point is dystrophic calcification. Dystrophic calcification occurs when calcium deposits in dead or degenerative tissue or in blood. Calcium level will be high. Key features will be damaged tissue, necrosis, coagulative necrosis to the in the patients is there. Calcium level in the blood is normal, and mnemonic for this is dying tissue dystrophy. Dying tissue, when there is dead tissue deposition of calcium, dystrophic calcification is that. So examples are atherosclerotic plaque, old TB lesions like gone focus, gone complex, heart valve like post rheumatic fever, and fat necrosis like parenchymal and breast trauma is there in the patient. History appears as basophilic granular material on H and E stain. Another one is give gritty white areas. Okay, so we have seen primary TB, we have seen dystrophic calcification, we have seen what we can say like okay, so this one is LD,